This is a conversation with Jack Rosenberg and Beverly Kitaen-Morse. Hi, Jack. Hi, Beverly.
Hello. Good morning.
Nice to talk to you.
So you pay a lot of attention to integrating body and mind.
Integrating body and mind. When you think of body-mind, body psychotherapy, people often think of something like massage, or you have hands on the body and you're touching a lot. And one of the things that we are very, very concerned about is if you do massage, you're really getting in too really close with the client, and it changes the relationship between the client and the transference relationship. So if we're doing psychotherapy with someone and we're massaging them, it really changes the way you have function with the client. So what we try to do is a body-mind psychotherapy in which we can work with the body without touching the body as much as most people do when we think in terms of body-mind psychotherapy. So we have a whole system of working that allows us to open and release muscular patterns and emotional patterns that doesn't not involve what we would call body-mind, call it like rolfing or massage, stuff like that. We have stress positions and things like that we can put people in that would allow them to release holding patterns.
Yeah. So we're talking about, in a way, deeply touching without physically touching.
Well, you start first with the relationship between the therapist and the client, of course. And in our training program, in our work, we make sure that we, as the therapists, are awakened and integrated ourselves and are able to actually make that limbic, energetic connection with people. And when we work with people, we work with the psychology, and we work with the breath, and we work with movement. And it's rather amazing always to me that in a very short time, we can help people have an experience of full opening and integration, being really present. If we mean by present, awakened inside, really there in the moment, but also clear of all those implicit and explicit memories that create probabilities, that create our views. So we want people to have an experience of when they're clear of all that. So we do certain kind of breathing movements after we've talked to them and taught them a little bit about psychology and made a connection with them. So when they have that experience, you know, that experience that people often have went from the best of yoga, the best moment in a good run, you know, surfing, many different things that people do. They have that moment of clarity, that moment of well-being and resilience and a sense of constancy. And that's what we do in IBP. We don't want to do therapy from a place where people are masked with the false self. We want to get under the false self, so we bring people to that integrated place and do therapy from there.
Yeah. So very clearly that sense of therapy doesn't happen in the false self, and what you're doing is help people bring to the present, clear of all the implicit and explicit baggage that exists.
So what happens in that type of atmosphere is those old themes will start to come up. Mm-hmm. And when they come up, now they're a little more distant so that people can look at them more clearly. And the breath work intensifies the material, the memories, the feelings, the emotions, the longings that come up, and they get to bring it up either from their own memory experiences, or they sometimes bring it up in terms of the transference, how they're feeling towards us and that attachment. Because we know that what we're really working with mostly are those early attachment themes.
Yeah. And so, in order to bring people in the present moment and with that clarity, part of the beginning of the session is going to involve some breathing and some physical exercise.
Well, not exactly physical exercise. I have a number. We teach students to have a number of balls. They're really weighted balls, and they start with a 6 pound and 5 pound, but 4 like that. So that the client is lying down, and we put a ball between their legs and one underneath their feet. So now they're balancing, and they're having to pay attention to hold one ball between their legs and one on their feet. So as they lie there balancing and holding that ball, one thing they're doing is they're tiring out the adductors of muscles to the pelvis. So they're opening the pelvis by tiring out the adductor muscles. So we're just talking to them, talking about what's going on, and they're lying there holding the ball with 2 feet. Their feet are on a ball, balancing, so that they have to pay attention, and they can't just kind of fall asleep or they drop the ball. So they're while we're talking to them, they're opening their body. And when they get too tired, they might put a strap around, and that makes it so that instead of the abductors, you get the adductors. Muscles are being tired, and that's how we start. Of course, we're just talking to them all the time. We're doing that, so we're not touching the body in a sense. We are touching the body and doing very profound openings of the pelvis and grounding the person. At the same time, we're talking to them about the deepest parts of emotional therapy.
Well, if we pay attention, that we know, even if we're not therapists, we haven't done a lot of work, we can meet new people and have a pretty good sense of who they are and what they're like and whether they had very good parenting or not. That's pretty obvious because those patterns are that keep us being certain ways, keeping the old things going, are both in the mind and the brain. And there, those, as we say, that brain mind is throughout the whole body. We know that a lot of those patterns are in the physical part of the body. So that's what we're releasing. We're releasing people from being caught into those implicit early utero, first year of life kind of relationship patterns. The patterns we know get set of how we think about ourselves, how we think about others, and how we think about the world gets set before we really even have explicit memory going. So it's only through the body that you really can get to those deeper memories because they're so visceral. So we really work with people paying attention to their body always, feelings, sensations, emotions, images. What are you feeling? What are you feeling in your body now? What are you experiencing? And little by little, all the old memories of early childhood start to come through because most of them are stored not in explicit memory but implicit. And if you just talk to people, you only have the later memories of children trying to make a coherent narrative out of how they feel.
Yeah, so it's really bypassing the layers of coherent narrative that we did, from the time even from early childhood on, but to get to that more basic, earlier pre-verbal, pre-conceptual experience.
Michael Ballant wrote a book about the basic fault. And it was excellent, and we learned a lot from it. We use it quite differently because we are not theoreticians, we're clinicians, so we use it quite differently. But we really look at the very first experiences in utero, and as you know, that they're now finding from the research that babies are learning so much in utero because in utero, what we're experiencing are that emotions are chemicals. So the baby's getting the most chemicals from that mommy, that closest inside of who mommy is, whether it's safe, whether there's going to be taken care of, and whether there's anyone really there for them, and whether mother has a strong core and is attaching. And so that baby, even when it's first coming out, has some sense. And it's very profound for people when they realize how early these patterns get laid down. So people start to feel that sort of existential aloneness and the relationship aloneness. So the two kinds of aloneness kind of merge, holding each other together. So that is very powerful. So in the existential, we're all in that together. But in the relationship, we need to have that comfort and soothing and connection from mommy, from daddy, from our caregivers to not have to feel that void.
Yeah.
Not to get lost in it.
So that the experience and in the work is to be able to connect both to that existential aloneness
Yes.
and to what happens in relationship. And then the relationship part is all the ways in which we have been conditioned by our past to deal with how to basically make life bearable.
And we tend to confuse the two. We tend very often to confuse existential, transpersonal, spiritual themes with psychological themes. So one of the things that we try to do is separate the relationship, psychological themes, because those we can really work through. Existential themes we really have to meet and accept, and our issues of existence.
Yeah. So how would it take place, for instance, is there a case or a vignette or something that could illustrate, the difference on a clinical level of dealing with both or dancing along the fine line between both?
Well, the most common probably is that when people start to do this opening, awakening work, they go more towards existential. Often people have life crises like losing a loved one, having a serious illness, losing a job, a birth. Huge existential issues come up, and people are ready to more open to existential spiritual themes, and they feel the aloneness, and they immediately say, he or she is not paying attention or not there, or they suspect them of having an affair or something, and it's up to the witness, the therapist, to be able to have a sense from tone and quality and what else is going on in their life, whether they're really just openings to something larger than the self, because they've connected to something inside that's very deep.
Yeah. So that in a way the question or the inquiry, the curiosity is in the therapist's mind of what am I witnessing, what am I, in this relationship with the client. Is it something that still is at the relational level of trying to find help dealing with existential crisis in this relational, or is it something that getting in touch with something larger?
Just like a number of years ago, we had a large earthquake about 15 years ago in Los Angeles. People came into our offices and they looked almost translucent. They were so not in their bodies. And mostly what they wanted to talk about was who was there and who was not there, and find a fault with their partners. Mm-hmm. And when we could shift it and talk about the existential experience, their hearts were more open. Another way of looking at it is when we do a lot of couples therapy. Mm-hmm. And in couples therapy, the main issue always is, one, to pay attention to the problem they come in with, but more primarily is to help them have that limbic heart connection. We now know that there are limbic fibers around the heart. So we know that when someone has been stressed by something, maybe they had a hard time with the kids or at work or something, when that happens, the part of our body that usually closes first is our chest, right? Mm-hmm, mm-hmm. So when our chest closes and we come home and look at our partner, we're most likely not going to feel love or attachment, because our chest is closed. Mm-hmm. And so then we start to think, well, what's the problem? Have they done anything to earn our love today? Or something's wrong with us that we can't love. So we get very confused between existential and psychological. We get confused between the body and not thinking, well, maybe my body's closed, that's why I'm not feeling it. Mm-hmm. Actual reality and relationship.
Yeah. So, for instance, I want to backtrack a little bit. You mentioned the earthquake in Los Angeles and people arriving and, standard normal reaction, something goes wrong, blame the person close to you, the partner, and so there. Mm-hmm. But you take it as a gateway. And the work is to transform in a way that, blame situation on the relationship, on the partner, to something about an expansion, to more of a consciousness of the existential situation.
You got it.
Well, and a consciousness and a responsibility for their own one-person problems.
Yeah.
Their themes. If they have an abandonment anxiety, and let's say on a scale of 1 to 10, if they carry that from their childhood, at a 6, let's say, mm-hmm. all their partner has to do is a 4, and they go 10, 10, 10, 10. Mm-hmm. And, if they do that, their partner's going to think that they're crazy, they're out of bounds, and be defensive. But if they can take care of their 6 and only talk about the 4, they'll get what they need and have compassion and support from their partner. So whether it's a student of ours or a client, whether we're working with individuals or couples, one of the first things we do is we ask people to that the work is always on themselves, that they are responsible for their one-person challenges.
Right. And so, for instance, in the example of the couple that you mentioned, you describe how physiologically what's happening is there's a problem. The heart is going to be closed. The chest is going to be closed. Then physiologically, it's going to be harder to relate in an open and expansive way to your partner. And so, mm-hmm. by putting the attention and the focus there's a sense of giving the person the responsibility for what's happening is their own thing as opposed to your partner.
Mm-hmm. That's why we work with the breath.
Yeah.
So we can lie someone down and have them take some breaths. And as they breathe, they change the balance between the sympathetic and parasympathetic nervous system. Yeah. And we reset it, as it were, in the session. And at the same time, they breathe a while, they change the balance, and then we talk to them about what's going on, and we take some more breaths. If they have the feelings come to the surface, they can take the breaths and breathe through them. And we're working with them with the body. That's what we call it, integrative body psychotherapy.
Yeah. So what I'm hearing there is a sense of that integration is also that in the rhythm of the session, there is a dance between the talking and using conceptual tools and narrative, and at the same time the work with something like the breathing, in order to notice something, the agency about being able to do something by acting on your body.
Like changing that balance.
Yes, and if we were working with a couple, we wouldn't have them lie down on the table and do the breathing. We would have them sit up in their chairs. And what we would have them do is breathe and use their eyes, look around, get really present. And we would do the presence work until they got really centered and could connect with that I am experience high in their chest, that deeper place in their chest. What we have found in doing this work all over the world is that if we say to people, where would you point in your body? If you were going to say, this is me, and 99% of the people point to the upper center of their chest. And they say, this is me. So that's where we tend to direct people, even though that feeling can be all over the body. We want them to have an easy access. Right. So we teach people to go back to their center. So when they can find that center, then we have them look at each other, but hold on to their inner center, and then just meet halfway and not let go. Because the major issue with all of us is that when we are that little infant, very, very young, we learned that our own inner volition, our core voice, whatever term we want to use to call that inner compass navigation system that makes us the author of our own life, that voice gets quickly compromised by who we attach to, mainly mother, father, And what we have to do in that relationship, is it okay to continue having that voice and have the bond and attunement? For most people, there is some level of having to avoid that inner voice so that they can pay more attention to the other person. Usually mom. Maybe mom needs some stabilization. Maybe mom needs you to be a certain way so they can get the love and attention they need. But whatever happens is that people tend to abandon, disassociate from that voice, and then listen to other voices that are more relationship voices, that are more surface voices, false self voices. And so one of the main tasks is to help people come back to that original, deeper soul essence, spirit, somatic sense. So if people abandon that somatic voice for another, then they will feel insecure, they will feel unsure, they will feel often angry, betrayed, and then they go back to the relationship and they think that's the problem, or the thing that they've done, they think that's the problem. But the problem isn't the problem. The problem comes back that they have again abandoned their own deeper inner voice, that connection, that somatic connection, that integration inside. So, for instance, last week I had a relatively new client who was doing the breath work on the table for the first time. And he quickly came to a full integration. He was a runner, so his body was more adaptable to it. And he kept telling me over and over again everything that his wife was doing that was hostile to him. And I kept saying, what happened to that inner clarity, that inner feeling of self? And he'd say, oh, okay. And then he'd take some breaths back into that place. And I did that about 5 times with him. Every time he started blaming her for something and he would start to lose his integrity, I would say to him, remember that clarity you were feeling? Where did you feel it? Oh, right here in my chest. Okay, can you go back and feel that? Pretty soon he said to me, oh, I don't have to get all upset about what she's doing. I can just go back to my body. I can go back and I feel calm and I feel centered and I don't get pulled into her things.
So that was a beautiful example. Thank you. And I think that what it shows apart, maybe I want to try and summarize what I'm hearing, is that sense that what the breathing does is it brings you back to that place in the center of the chest, that you mentioned is where we feel we are. And that place itself and that sensation of I am that's related to the breathing and the openness is also not just about that place in the chest, but is actually part of the nervous system being free from the push and pull of the fight-flight actions that have been, stored in our memory from the past interactions. So coming back to that place is a place of actually calming the nervous system to come to a sense of, who I am, and then from that more solid, integrated place, be able to face, dangerous problems in a more grounded way.
We actually call that the I am experience.
The I am experience, yeah.
Yes, we think of that as the essence of being a spiritus, that life breath, that breath that comes in, that first breath when we're born, that leaves with that last breath when we die. If anything continues, it's probably that. So we forget often to keep connecting with that, all in the middle.
Yeah, so the I am experience, and then, that sense of the breath related to it, and many traditions think of the breath as the spirit, or etymologically the two words are connected, so that's a part that's very central. And that's in that sense of how it's related to the nervous system, and in turn to the history of early attachment and orienting to the world.
And one of the other things that we do, we're also a teaching model. We make sure that we and our therapists are very integrated and grounded and present and have that openness to connect, but still have good boundaries. But we also teach mental health skills and mostly about how to, when we sort of lose our integration and become fragmented, we teach steps of getting back, because fragmentation has to do with something in the current event that triggers an old theme from our early childhood history. We call that the primary scenario, because it's like an inner movie that we keep inside of us that we use as reference for our emotions, making sense out of everything. So we teach them to work in the journal, and we have many tools that we use. That would be way too many things to talk about here, but we have many tools we use for people that they learn to take responsibility for their own mental health.
Yeah, so a sense of being able to, when pulled back in the wound, in that primal experience, to be able to step out of it and come back to the present moment. So these tools are ways to go ahead.
And to full integration.
To full integration, yeah.
It's both in mind and body.
Great. So I wanted to just come back to actually something that Jack mentioned at the beginning. Just you were mentioning the session with the person lying on their back, with the ball on the feet, and so I want to just double check. I know that Beverly mentioned when it's a couple they're sitting, but when it's an individual, is the individual spending the session lying down on a table?
Yes. Well, I guess absolutely. Of course, I don't just bring them in and lie them down. I do a couple of sessions with them and taking it, what we call a scenario or history of their life and what's going on and what are they worried about and what's happening in their life. I usually take about two sessions, getting acquainted with them and finding out what's going on. And then I say, the next session you come in, if it's a woman, please wear slacks, so that I can put you on the table and we can start to work. And then I have them lie down and I use the ball and have them on the table, put the feet on a ball and the ball between their legs that they can hold the ball. Now the ball holding between their legs opens the pelvis. All the muscles in the pelvis there get tired. And when they get tired of holding the ball, then I put a strap in, an elastic strap, and that does the adductors. And that retires the whole pelvis. So without touching anybody, particularly women, I have done what I used to do by using my training with massage. I can do now by not touching them at all, and much more effective. And I open the pelvis, and mostly emotionally they get the feeling of, oh my God, and then they start to talk to you about what it is that's coming up from opening the pelvis.
And Jack, do you want to talk about one of the things that's different about IVP is that we don't just have people huff and puff and breathe. We make sure that they stay present and connected with us, and they stay within that window of tolerance.
Yeah. Again, when I say have them breathe, I don't just breathe them up and then down. I take them up, and all the time they're working, they're staying with a high charge in the breath, which keeps the parasympathetic nervous system going. So they're breathing and they're at a feeling tone in their body, so that when you say something or they say something to me, they're really emotionally really charged.
We've had so many people come to us from other therapists that have done even just meditation work that was deeper than that person could tolerate. And we have people who have done a lot of breath work that they weren't encouraged to stay present with the observer, the therapist. Yes, and so we're very concerned about that because people can get very lost in it. So we make sure that when people do regression, that they've already learned how to come in and out that they've learned how to stay connected. We don't want to send them home in a puddle. We don't want to send them home to get lost in it and to be able to disturb their life because of the therapy they're doing. We only want them to go into as much regression as they can incorporate into their life, into their understanding, and be clear and stable and resilient with.
Yeah. So very clearly, the focus is on being clear and resilient, and so that's a means to, the breathing is a means to that end, as opposed to simply getting into whatever level without consideration of whether that's within their bandwidth or not.
Yeah, some of that I've had a lot of therapy myself, and the stuff that happened in there, I would never treat people like that. It was done many years ago, and never. But the Reichian therapy I had, I'd scream and yell and did all kinds of things. And man, it took me sometimes 2 or 3 days to recover from the stress.
It can take longer than that. I know. We've been around doing this for such a long time. We know when people were doing therapy quite differently. Yeah. And we know how to blow people open, but then there's a lot of residue, and sometimes people close down much more than they were to begin with. And so it's another injury if we don't take people step by step.
Yeah. So
it's kind of worked for a long time, which I have. And I figured out it's about 40-some years now. And you really want to be careful with people. You're dealing with a human being, not a body out there.
Yeah.
And so we're very careful. And that's one of the reasons I developed the system to not do a lot of massage or touching and stuff like that with the client, and still get the work done. And releasing the fixed muscles, the patterns that are in the body. And it's amazing how rapid that is, and how functional really it makes our work as therapists.
Yeah.
You're not, particularly a man working with a woman, even though I have a secretary sitting right just outside one door, but it's a very delicate kind of situation. So,
Yeah. So there's that sense of respect for the person.
Absolutely. You can't get any more conscious clients, the therapist than we are in that particular way. I don't have people take their clothes off. I have wear clothes that can work it, but I don't work with them naked. And all the stuff that we did back years ago is gone.
Yeah, IBP is both practical and transformational, because we work with, the deeper issues and awaken people at their core. And when you do that, people make a shift in their state of consciousness. And then you exchange the lens through which you see life through. Yeah. And if someone comes in and they're fragmented, or they're just in their normal false self, then they will tell you one story. But as soon as you awaken them from the inside and get them centered and grounded and clear, then they will tell you, you'll say, what's the problem? They'll say, well, there isn't a problem, but here's what I'd like to look at. And they'll look at it in a very clear sense. So why do therapy from a place that will never get integrated and never will get will create that same kind of constancy that it creates when you do the meditation, what we call sustaining constancy exercise. We have an exercise that we have people do in the office and then take home with them. And when people are doing this work, they tend to begin to have what we call constancy, that inner stability, inner clarity. It holds. We have most of our people come off of any medications they were taking before they came to us, because they don't need it anymore, because they have that inner place to turn to that is stable and resilient and clear.
Yeah. So that sense of, that helping people develop the ability to sustaining constancy. Yeah.
Find it, know it, be familiar with it, and they do that with us a number of times until it's so familiar that they can do it on their own.
Okay. So is this a good place to end, or would you want to add a little something here?
Well, I would like to say something more about the sustaining constancy.
Mm-hmm.
I was just trying to go to the other room and get a sheet and hold it up right with that.
But they're not recording.
Oh, you can't take
I'm not taking the picture.
Oh, you are taking the picture.
Right.
This is my picture, but you'll see that picture. But the sustaining constancy, I worked on it for so many years. It opens every segment of the body that you can do for yourself. You can do these exercises, and so I have printed out pamphlets of plastic that I get as soon as I get a client is working. I give them the sustaining constancy to do for themselves, so they then have something they can do at home. All they need is a couple of balls and a strap, and they can at home do a series of exercises that clears their mind, clears the body, and makes them feel together. And it's just an amazing set of exercises that we've been doing for years.
Yeah. So I see the part where it's you mentioned Beverly mentioned earlier the teaching model, that there's that part of the teaching skills. Yeah.
I would finish probably with Jack and I are just completing a new book on aging, people 50 and over.
It's a whole new world.
As we age, we no longer have the body defense systems, the armoring. Mm-hmm. We no longer have the busy multitasking. We don't have that left brain linear clarity and strength that we once had, but that allows all sorts of those unresolved holding patterns to open, and a lot of feelings, emotions, and longings come to the surface in a way they never have before. And if we think that they're about the present because they don't come saying, oh, this is a memory, it comes with the feeling tone and the fear and the belief, so people think that that is happening now. And it's very important for us to be able to process that if we're to have our constancy and resilience and clarity and well-being and sense of self in our latter years.
Yeah. So in a way that what happens at that age is some of the defenses or some of the mechanisms that allow people to override, in a way, some of these issues in earlier life are weakened, and so these issues come to the full force. But that's an opportunity to actually deal with them.
Yes,
it's always an opportunity. Every difficulty, every pain, every problem is always an opportunity, and aging is the best opportunity to really clear all of those things up.
That's why the sustaining constancy is so important. You can give a client a simple series of brain exercises they do with their body, and they can feel good again and last for a day or two. It's an amazing brain exercise.
If someone was to have a car accident or drowning, they talk about everything flashing, their whole life flashing before their eyes.
Yeah.
And as we age, our life starts to flash before our eyes. We need to know that that's what's happening, that it's not about now.
Okay. Yeah. So maybe that's a wonderful part of, in a way, that we loop the loop with, the stuff that's happening is not about now, and that's where we find the theme that we had earlier as well, and that integrative approach is to find ways to remember that and deal with it.
Yes.
I'm part of the most senior of the therapists around. Next September I'll be 80 years old, and I'm still practicing, and I love it, and I enjoy it very much, and I'm still as alert as I ever was. But I feel like I'm a better therapist now because I'm more cognizant of a lot of the stuff that I see in people as with them, and able to pick up into. I have a background now, a whole trash can full of stuff that I use. It's just amazing.
Thanks, Jack. Thanks, Beverly. This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.
Part of the most senior of the therapists around. Next September I'll be 80 years old, and I'm still practicing, and I love it, and I enjoy it very much, and I'm still as alert as I ever was. But I feel like I'm a better therapist now because I'm more cognizant of a lot of the stuff that I see in people as with them, and able to pick up into. I have a background now, a whole trash can full of stuff that I use. It's just amazing.
Thanks, Jack. Thanks, Beverly. This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.